All right. Does anybody have any updates that they would like to share if we get started? I'm Celeste Clark. I'm the director of the Raymond Coalition for Youth. As I mentioned, we're going to be recording this meeting. It is the first coalition meeting that we've recorded in light of our current situation with everybody joining in remotely. And we thought we would take this opportunity to use the presentation to share it. We hear from people often that they can't make a 9 o'clock in the morning meeting, and if we would have an evening meeting or an afternoon meeting. And we have done that over the years, tried to switch the time to see if that would be a better time for people, and it's just never worked out. This 9 o'clock, the second Thursday, seems to be the time frame that the majority of people can make it. So we're going to record this episode, and we're going to see if that helps. We'll post it on our social medias and email and see if people like it that way. If that works out, that'll be something new that we can look into moving forward. But with that, I'll open the meeting and see, does anybody have any updates or check-in information that they would like to share with the group? I know several of you have programming that are going on. I'll just pick on Chris because I know he has one, so it can be an opportunity for he or Chelsea to speak about the program they're doing. If you'd like to.
I think he's on mute.
He is, he has to fix it.
Hi, thank you, Celeste. Again, my name's Chris Bishop. I'm the Teen Driver Program Coordinator at the Children's Hospital at Dartmouth-Hitchcock. Right now, we're doing a couple things. I'll speak to the media challenge, and maybe Chelsea can talk about the sort of social media thing that we're doing. So right now we're running a media creation contest for students in grades 6 through 12. Information about this can be found on the Teen Driver website, nhteenDrivers.com. But it's a media creation contest with the goal of influencing your peers through visual, so like a video, a radio PSA, or a script. Winners get up to $1,000 cash prize as an incentive, so that's really great. And we are accepting submissions until June 12th.
Very cool. And Chris also told me that if you are out pumping gas in public, which is a very cautious, you need to be cautious doing that, right? But you might see him or Chelsea while you're at the pumps, which is very exciting. I'm looking forward to going and see if I can find that ad. So, public safety.
It's funny you bring that up, Celeste. This is Chelsea from the Buckle Up New Hampshire program at the Injury Prevention Center at CHAD. But my mom actually messaged me last night saying that she saw my face on her screen while she was pumping her gas last night. So it's definitely out there.
That's very cool.
So just to piggyback off of Chris and talk a little bit more about what else we're doing. In May, it is National Youth Traffic Safety Month, so we are using ourselves as well as our partners to get some messaging out there. Last week was kind of a general traffic safety message. This week we're focusing on distraction and wearing your seatbelt and focusing on different messages every week. Next week's going to be speeding and, sorry, that was my dog. And, you know, just trying to get the message out there and push it however we can. You may see our face more often than you currently are.
That's very cool.
Yeah, and then I don't know if I said it at our last meeting, but our seatbelt challenge that was supposed to happen in April has been pushed until September at this point. That is currently scheduled for September 18th. Pending what's going on with COVID-19.
Very good. I know there was a report issued last week about how traffic accidents are higher than normal now, that they've gone up in spite of thinking people would be home, that they would go down. So your job is very important right now.
Yes, it's unfortunate. I mean, we look at the data every single week, and it's a tragedy that we're up by, I want to say 166% with fatalities as compared to last year's at this same period of time. So that's a pretty big jump.
Yes. So thank you for all you guys are doing. We pushed it
Thank
out
you.
on our social media, and we can do it again to try and raise awareness to your efforts too. So thank you.
Thank you so much. We appreciate it.
Yep. Tammy, did you have anything you wanted to add for the rec department? You have to unmute.
I knew that. We are continuing to set things up for the summer. We've got trips planned. We've got some activities, all the stuff going on. We just haven't heard word on what's going to happen. So we will be prepared for when that time comes.
Mm-hmm.
So anything else you want to add, Michelle? Oh.
Nothing really at this time. It's still, everything's so touch and go. We will have some kind of program, hopefully, whether it be, you know, including trips or without, limiting our numbers. But we feel we need to have some kind of connection over the summer. So just waiting day by day, seeing what the numbers are and how things are changing and what phases are reopening.
I think that's really good, and kudos to you guys. I was telling somebody, I was on a state call the other day, and they were saying that their rec department isn't even putting anything together for their kids, and that the parents were really upset about that, but they weren't doing it. And I mentioned that I knew our rec department was doing their best to try and make sure that there was something going on. So kudos to the both of you. Thank you.
Yeah, we have a lot of parents out there that want it or need it.
Right.
So we're hoping that we can at least go forward.
Yeah. Very good.
If I could just share one thing I've noticed that might be helpful for the rec department. We've just, I think some of the schools at Raymond have offered like social hours with students, and they're sometimes getting upwards of like 60 or 70 students logging on. So even if there is the need to be virtual, just to remember that our students are really thirsty for connection, even if it's through the screen. So I know that our after school program was looking at putting activities online, but they're now going to see if they can really have some meetups with the students. So just every week there's at least 60 of them logging in at the middle school level.
Okay.
Excellent.
All right.
We've heard that too. Christine is having youth action meetings each week with the high school and middle school. And I am on the high school meetings with her, and our kids at the high school level, they're really feeling isolated and having a hard time. They've been in different weeks. You'll have a week when we'll be like, oh, they're doing really good this week. And then the next week they'll be like, oh, this is so hard. We haven't seen anybody. So those meetups are very important to them too. They talked about the high school pep rally or something that the principal had. So that's important that we have our connection like this to see the people that we work with. The kids really need that connection too. So thank you for sharing that, Jess. All right, any other announcements before we move on?
Could I quickly just let people know that I'm Pam Please from Exeter Adult Ed, and our adult basic ed HiSET teachers are not all teachers, but we're going to continue to have a teacher working with students through June 19th. And also ESL is continuing with all their programs through June 19th, both morning and day programs. And we're hoping if this building is open in July, we're hoping to be able to offer some HiSET testing then. There are some centers that we're sending some of our students to for that as well. In, I think, Concord. They're doing some individual testing there. But we're having asbestos abatement done in the building while it's closed and nobody's there. So, so we can't be in for that reason right now.
Very good, thank you. All right, anybody else?
Celeste, can I add one thing? This is Kim at Breed, New Hampshire. And I just wanted to let people know, some of you have heard our Vaping Unveiled program over the years. It's been an ongoing thing. We're offering it remotely at this time to communities, middle schools and high schools, and we've had a couple requests. So we join as a guest on Zoom or Google Meet. And then I don't know, Celeste, I'm sorry, I didn't see your agenda. Do you speak about YRBS, or did you at your last meeting? Because I missed part of that.
I'm going to have a one slide in the presentation that I'm doing that
Okay.
will speak briefly about it too.
Yeah. The reason I mention it is the use of vaping devices and vaping in general has gone up dramatically in New Hampshire. So we're trying to get the word out even more than we were in the past, that this is an opportunity before the school year ends if any school districts would like and we've shortened the presentation. So it's something we're trying to help out with. Thank you.
Very good. Thank you. Did somebody else have something?
I did, Celeste. It's Janice from the school board. I just wanted to talk very briefly about tentative graduation plans. The seniors and their parents were pulled. We were hoping to do something at the traditional end of school, but they would rather hold off a little bit in hopes that we could do a more traditional graduation. So graduation is tentatively set for July 19th. We have no idea at this point what it's going to look like. We will have many, we know what we want it to look like. We want it to be traditional.
You mean July 17th? July 17th.
July 17th. Sorry, Tammy, you're always correcting me. I can't read my own writing. I scribble here. If we can't do it traditionally, we'll do something that day, but we will honor the seniors.
Excellent.
And they're still going to have their senior night on June 12th.
Yes.
Yep.
Yeah, we're going to try and keep as much tradition as we can, but like everyone else, we don't know where this is going. So just wanted to give you an update.
Very good.
Thank you.
Thank you.
Thank you.
All right. Anybody else? So here's test one. We'll see if this works. The agenda is on our website, if anybody was interested in seeing it, but this is what it's going to be. Not that you can read it super fast, but again, it is on our website if you want to go peek at it there as I'm going through our first part of the presentation that we have for this morning. We're going to go and do it's Prevention Week, National Prevention Week for SAMHSA, Substance Abuse Mental Health Services of America. And Prevention Week is to raise awareness to the importance of talking about substance misuse. And so this is a good opportunity for us to share about the coalition and where we started, give a little bit of a history, and go from there. And if anybody has any questions at any time, please let me know, and we'll see if I can maneuver this whole thing. No guarantees, but because now I have my screen full with this presentation. So I'll try to go through quickly too. I know it looks like a lot of years, but the coalition back in 2000, the University of New Hampshire came to our community and asked us if we could assemble a group of people who are interested in talking about the need that they've discovered in Raymond. The university had written a grant for 2 years to collect data and then address the issues that they had found through the Youth Risk Behavior Survey. The Youth Risk Behavior Survey at that time showed that Raymond, New Hampshire had the highest rates of substance misuse higher rates of substance misuse compared with the state of New Hampshire. And Kim mentioned how we follow that data, and she mentioned the vaping. We follow that very closely. So when UNH came to us, they taught us that that was the first thing that we should be looking at is data when we're looking at anything that we do. They had a little over 40 people who showed up for their first meeting to listen to their idea, and then they tasked them with leaving if they weren't coming back to bring somebody else back. At the time, I was the PTO president at the elementary school, and our vice principal tagged me to be the next person to fill in for him. So that's how I ended up here. The work group included town leadership. Again, when the university came, they expressed the need for the movers and the shakers, if you will, in the community to be at the table to help move this forward. because it wasn't going to be an easy task. Prevention is not an easy thing. It's not an easy sell. People don't like talking about it, but yet it's very important. So our town manager at the time, Mr. Rick Bates, he had said he bought into the idea that the university was trying to get the community involved. And we had the police chief, the superintendent at the time, our high school principal, there was a pastor at our local church, parents were there, Tammy and myself were there. We had healthcare, and the rec department was there as well. And this was pretty much the group of people that stayed involved going through the process with UNH for the first 2 years. We also had school board members involved. And I don't know if you can see the little volunteer guy up in the corner, but he has a meaning. He has a heart, and the people who were involved in this were, some of them were told to be there, some of them were there because they had a heart to want to make a change in the community. And that really plays an important role in the things that we're going to learn as we move forward. In 2002, UNH, their grant was up and they were packing up and leaving. And they told our work group that if we wanted to continue doing what we were doing, that they saw our good efforts started, but they weren't going to be part of it. So again, the work group decided that we had done several programs in the community, and this seemed like a good thing to keep going. So that's when the Raymond Coalition for Youth was established. Again, all volunteer run. In 2004, Rick Oliva, who was from the University of New Hampshire, he was part of the coalition at the time, he offered to help us get our nonprofit status. And that allowed us to get our first donation from Hannaford Supermarket and hire a part-time staff member at 15 hours a week. But it was the beginning. That part-time staff person was able to then go, hold on. I'm not clicking my slides appropriately, so I apologize. When the coalition was formed, we realized the very important task that we needed to have young people involved, because we couldn't have a youth coalition if we weren't having young people. And we had a contest. This is our first banner with some of our young people, and that was the original Raymond Coalition for Youth logo. It was designed by a young person, and it went on all of our t-shirts and everything that we were doing at the time. And like I said, in 2004, we became incorporated. In 2006, we were able to get our first sizable grant from the New Hampshire Charitables Foundation to continue the work, having a staff person. We had a grant writer who was part-time working with Mr. Rick Oliva, and then myself, I became the part-time person as the director. We wrote a Compassion Capital Fund grant and worked with NAMI New Hampshire. That was the Connect Suicide Prevention training that we had offered. They trained several of us that were on that work group, and then a few other people, and then we all went out into the community, and over 500 people were trained in the Connect Suicide Prevention training protocols. And then we continued that pretty much every year, if not every other year. We trained businesses, schools, the rec department trained their staff, the police trained their staff. That's since, obviously, 15 years ago, that's now incorporated as part of the police officers' training to become a police officer. So that's the sustainability of that. In 2006, I showed you the first logo because we got a Compassion Capital Fund grant from the federal government to do sustainability plan, strategic planning, and looking at our logo and our messaging. And we came up with a new logo, which was definitely a growing pain for many of us who had been there from the beginning to switch where we were going and take it from something that was created by the community that accompanied and embodied what the community was. This logo was it. There was people were interviewed. It was quite the process to get the logo. And then we changed our very long mission statement at the time, because going back to that little heart that I had mentioned, we all had a lot of great ideas that we wanted, that we thought prevention was. And we were learning as the coalition was evolving on what we were supposed to be doing to actually have long-term impact. That brought us to 2008, when the state of New Hampshire got a strategic prevention framework grant, and the coalition was involved in that. And that taught us the model that we now use for prevention work: assessment, capacity, planning, implementation, and evaluation. So everything the coalition does is a process. And it started with the first thing that UNH taught us was it was data driven, that we had to look at what the situations were in our community so that we had a plan to address them, that we were working strategically to move forward. And the capacity piece, the second part, excuse me, you can't do anything if you don't have the right people at the table. We can try to do our work, but if we can only do what our capacity is. And I think that's a really important message that we've been working on. Some people come to us and ask us if we'll do certain things that don't fit within our mission. And now we know that we can say, that doesn't exactly fit with what we're trying to do. So this process has taught us a lot of things. It also taught us about the public health pyramid and where the coalition work is, where we can put our strategies. So if you think of individuals at the green level, at the primary universal, that's where we can reach the most people with the messaging of the coalition. We had worked with the school and we had written grants and we had connected dots. Prior to the coalition being here, there was no mental health services in the schools, and we worked with Seacoast Public Health, and we got somebody at the high school part-time, very part-time, but at least it was a start and it opened the door. And that person targeted more of the purple and the red level. And then as time went on, we wrote a grant and we got a student assistance person at the school. And again, that person did more of the purple and the red level, where the coalition itself focused on the green level, the community, the student body. Those are where we put our efforts. And we realized that when we're choosing things, the strategies that are in the box there, providing information, building skills, providing support, those are the things that we look at when we're choosing programming and find a way, which section do they fall in and how can we make them work for us? So who is responsible for prevention? I think some of you have seen this little guy before. When the coalition first started, the little octopus on your left-hand side really explained things. I mean, if we're all not working together, that's what our jobs can feel like. We can't say that the police department is responsible for drug misuse in the community. We can't say that the school is responsible. We can't say parents are responsible. But if we're all working together and we're all moving in the same direction, you have a happy little octopus. Our community is much better served that way. It takes communication and it takes work, but it's really important, and we can really see the sustained efforts that we have seen. So to get our, let's see, in 2010, we got our drug-free community grant, that was our third try, and a lot of communities don't understand how long it took us to get that grant, that it just didn't happen. There was a lot of hard work and a lot of requirements. And this here graph shows all of the people who are required to be a part of our coalition in order for us to continue to have our funding. So we need to report on this twice a year and say how we're working with these partners, what their involvement is, and how it's contributing back to that octopus picture of us all working together to move forward. It also taught us this. I had mentioned our first strategic plan that we had done back in 2006. I think we had 8 goals. It was 8 pages long. It was very cumbersome. If you had to give it to somebody, they looked at it and they were a little overwhelmed with all of the information that was in it. And when we got our drug-free community grant, they really boiled down what prevention looked like. Again, we had to have the 12 sectors. We put it down to 2 goals. So our 2 goals are to increase community collaboration and to reduce youth substance use. We also have a piece in there about our youth voice. So we have 4 goals because our youth are so very important. They're integral to everything that we do. So including youth voice, and then the long-term sustainability of the coalition. So it's still 4 goals, but it's 4 manageable goals. So when we're telling somebody the story, we're not trying to think of all of the things that we're doing. They're a little bit easier to talk about. That brought us to 2013, where we had to submit a sustainability plan for our grant because they made it clear they weren't just giving us money without having requirements. And one of the requirements was that we were actively looking to see where we were going to be at the end of our 10 years of funding. So we had to put together a plan to say how we were going to raise funding to continue the efforts. And some of these things that are in here, I'm not going to go into them all, but the Prevention Summit, some of you know about the Prevention Summit. Our gala fundraiser was one of the things that was developed out of that. And then in 2015, we got our second round. But it raised the question, Christine and I have spoken at CADCA, Community Anti-Drug Coalitions of America, their conference several times now about how our coalition operates and the work that we do. And our most recent one was on the sustainability of a coalition and asking people what's more important for your capacity, your people or your money. And at the end of the day, they're both equally important. Yes, you need money to do what you're doing, but if you don't have the people, you can't do anything. So our partnerships are priceless to us. I mean, we can't do the work that we're doing if we didn't have everybody who's part of the coalition, a part of the coalition. So we're very grateful for that. And we always say that when we're at the conference, Christine and I will stand up there and we'll say, you know, we're here representing our coalition, but we are not our coalition. We are just two people who happen to be able to share this information, but everybody who's part of the coalition is what makes it work. So then in 2017, we had to have our second sustainability plan given over to our federal partners to say how we were doing and what we had in place. We really had to have a diverse piece of, you couldn't just have grants and donations. So we've been very diverse in what we've been doing. And we share this graph because if you look at it, the 26% light blue is our drug-free community grant, which we are in our last year of and will expire in September. But that grant allows us to leverage volunteering and things in our community that the 57% lime green, that is a very low estimate of what we give back into the community through volunteering and services and programming. And then the other things, the other grants that we've written, fundraising and donations, indirect fees, sponsorships for our events, they're very important to us. They obviously don't have the bulk of the funding that we have. And we push that back to the people who are part of the coalition, make up the coalition itself. And Kim, this is for you, well, for everybody, obviously. We've been collecting data since the coalition started. So each category is broken up into alcohol, marijuana, and e-cigarettes and vaping, because those are what we've been collecting. This here graph shows the first 1, 2, 3, 4, 5, 6, 7, the first 7 lines are all Raymond High School data. The very last line, the green one, I just got this in 2 weeks ago, I think it was, is the state of New Hampshire data. They collect theirs a little bit differently, and it just came out. So it's a year old. We've been working with our data since last September, I believe. We put some programming in place throughout the school year, which is why we're very fortunate to be able to work with the school district and use our evaluator instead of waiting for the national evaluator, which takes quite a bit of time, as you can see. But when I was crunching the numbers of the day, I was very excited to see that where Raymond is, again, the yellow column is for 2019, Raymond High School. You can see that we're lower in all 3 categories than the state of New Hampshire. In the state of New Hampshire for vaping, Kim's absolutely correct. It raised 10%, went up 10% in the state of New Hampshire for vaping. So it's obviously something we've been watching. We know it's a concern. Our school district's done a lot of training. We've done a lot of awareness with the kids. It did go up in Raymond, but it certainly didn't go up as much as it did in the state. And we attribute that to all of the efforts that all of us together have been putting in place to try and address this. Marijuana use is lower than the state, and alcohol, I mean, those are, looks like 4 and 5% is not much, but when you're thinking about these numbers, that is a lot. That's a very big drop. So we're very fortunate. And that, again, is for our community working together, providing this information to our kids and adults at the same time. So when we look at the history of the coalition and where we've been and where we are now, increasing our community connections, we'd like to think that we're very fortunate to have all the people that we have. We've gotten some recognition this year, which is very exciting, especially when we're coming to such an important year moving forward. So we're excited about that. We look at the data, we are making success that way. So the coalition has done what it started out to do. And now we're in year 2020, and the question mark, where are we going? What are we doing? As far as sustainability, we're in a good place, but it takes us back to this question, which is very important, and our board of directors has started to do some work, and we hope to bring this forward into the community. Now what? Where is the coalition going now? Is it the same need? Who are we now? Who's part of the coalition? Do we have the same important people at the table that we need to make these decisions? I mean, these are important questions, and our history has taught us that we need all of these people, that we just can't have a few people at the table. If you want to implement community change, you really need everybody with a voice who reaches a certain population that you want to reach. They need to be part of the conversation. So we're really going back to the starting line. So our board chair has started this process with our board of directors, and I want to make sure that there's definitely a connection to everybody who's a part of the coalition and their voices being part of what the board is looking at. And again, as we move forward, there'll be a lot more of this. It's very exciting. It's a little scary because, as Allie, our chairperson, says, we've always had a plan. Our strategic plan has ended, our grant has ended, but this is opening up a whole different world of possibilities for us. We're obviously not going to go do something that's completely out of line with the coalition as far as addressing a community need. We want to stay with what we're doing because we know this is important, we know this is a need, but what is that going to look like? What form is that going to look like? So I wanted to ask all of you, if you think about the coalition, what are 3 words or 3 phrases that you think of when you think of the Raymond Coalition for Youth? If you want to submit that in the chat line, or if you want to email that to us, that would be great. It would be very important for us to help with moving forward. And with that, I wanted to see if anybody has any questions. There's a lot of information really fast. Anything? Nothing? Any thoughts?
Yay on the YRBS. Yay!
Great presentation, thank you. It's nice, I haven't been involved that long, so it's nice to hear about the origins and the process.
Thank you.
Are there any thoughts about how to make up for the funding that's ending?
So we're always looking for different grant opportunities. I had mentioned in the beginning of the presentation how the state had a strategic prevention framework grant. We've applied for one of those locally. Again, back when in 2005 or 6, I think it was a state grant. So the chances of us getting it are small, but it would help us walk through that whole process with our community. Some other exciting information. I know I have Jess on the call here today from the school. The Raymond School District got a Project Aware grant, and they're kind of in the same position that we were in when we had our Strategic Prevention Framework grant several years ago. So we definitely don't want to duplicate anything that the school's doing, but we would like to complement that. So Jess and I have been talking a little bit about that and how we can move forward. But again, the school obviously has what they're doing for the grant. We want to see what the community and the coalition can work together. I don't know if you want to say anything about that, Jess?
Yeah, absolutely, Celeste. Thank you for bringing that up. I think that Project Aware is an exciting endeavor to consider for the school district, and it does have a strong component in terms of engaging the community. And the coalition was one of the identifiers of readiness for this project and part of the reason why Raymond was awarded this grant. So yeah, I think that we're still in discussion of how that's going to sort of complement one another to make sure that there aren't duplicative efforts and that it's coordinated. But I'm really excited to you know, sort of think about what that looks like for the coalition in the district.
Very good. Thank you. Does anybody have any other questions? Just to answer your question on the sustainability piece, we've done exactly what the grant has told us. I don't think that, I don't like to brag or anything, but we've really taken our drug-free community grant and we used it exactly as it was intended to be used. And that is what Christine and I present when we go to these conferences. It's a hard grant to get. There's a lot of requirements to get it. But if you follow what they tell you to do, it's a roadmap to success. If you do what they tell you and you engage the right people and you have your sustainability plan, we've done that. So our coalition is in a very good spot right now. We know that for 2 years, we have enough funding to, at least 2 years, if not 3 or 4, we have enough funding to keep operating in some capacity. It may not be with all of the t-shirts and mugs and pens and things like that, but, or all of the trainings and trips that we've been on to present at these conferences, although we get paid to go and do those, so that's not a bad gig either, but we're in a good place. We've done what we were supposed to do. But the really important piece that was the last 2 slides of that presentation is the Drug-Free Community Grant gave us a roadmap for what we were working on. And now the coalition can look at what we're going to be working on and see if those are still the same priorities, see if those are still the same things, and have a conversation about that. And that might look a little bit different. It might look the same. But again, we really hope that all of you will be part of that to help guide those decisions, because we don't want it to be just a couple of people making the decisions. In order for it to work, we really need our community to be part of that and engaged in the process, because then people will have buy-in to the need of it, if that makes sense, hopefully. Any other questions? Yes, Stephen.
So where is the coalition going next is a very interesting question. And I well remember what it was like when we got the DFC grant. I suspect the words FedEx box still create shudders for Celeste. That third try, I believe it was like 5 minutes about, was the margin of error getting that, because back then we had to submit in paper.
Yes.
And Celeste was a much younger looking woman then. No, sorry.
That might have aged me a little bit.
But anyway, I was around then when we did that, and one of the concerns that I had was that we might the coalition might take a certain direction that was heavily influenced by the idea of prevention, which I mean, I'm not saying that I'm opposed to that, but one of the things we had talked about was the idea of positive youth development, where we, instead of focusing on the challenges that our youth are facing, we challenged on their strengths in building resiliency and that sort of approach. And I'm very happy that the coalition got the grant, and that I think a lot of good work has been done that was supported by that. But if we're looking at where are we going to go in the future, perhaps it might be time to re-up our focus on positive youth development.
Thank you, Stephen. So we've had several conversations. Our last 2 prevention summits addressed the ACEs, the adverse childhood experiences, and trauma to children, stress. We've been looking at those things and how to move forward. And again, I think that speaks to Jess and the Project Aware grant, because for the school piece, that is pretty much what Project Aware focuses on quite a bit. So having that tie into the community and having the community be aware of that, I think is a natural fit for us. And again, that'll be very important to hear people's voice on that. And Jess, do you want to add to that?
Yeah. So I think a big focus of the Project Aware grant is really building out that multi-tier system of supports for our students, right? And so the same pyramid that you showed in your presentation is something similar that we need to build within the school system. But obviously, you know, for us to have the most success, we need to partner strongly with the community. So really my first sort of order of business is really looking at the prevention, the universal approach that we're taking to all of our students in the building, to see, you know, and each school is in a different place with that. So that is a huge focus of ours, that we understand that our students need to have that foundational skill set of social and emotional wellness before we can really expect them to be addressing risk factors or really succeeding academically.
Thank you. Any other comments? No? Okay. So another piece of Prevention Week that I had mentioned when I had started that, on Monday morning, we had the privilege and the opportunity of DEA Special Agent John Delina contacted us last week. So if you didn't hear about it, it happened very quickly. And he asked us if he could work with us for Prevention Week to help raise awareness to the issues that the DEA is seeing in light of COVID being here and people not really talking about addiction and substance misuse. He really needed people at our prevention level to know what was happening and know what was going on and to help him get the word out. So he gave us an hour of his time on Monday morning. It is recorded. It is on our Coalition YouTube page. But he talked about the things that we needed to be aware of as a community, the issues that as a DEA, what they're seeing for drug trafficking, especially in New Hampshire and New England, because that's his area. And he talked of most concern to us about manufactured pills in Mexico. They're manufacturing them with fentanyl to look just like Xanax and Adderall. And when talking with our young people and knowing what our young people are abusing for pills, those are typically the top pills that we hear about. They have no actual medical substance in them. There's some sort of whatever, sometimes it's baby formula, flour, sugar, whatever it is, but then fentanyl mixed in. And these pills look exactly like pharmaceutical pills. So we need to find a way of educating our community that not to buy pills off the street. If you're not getting them directly from a doctor, that the DEA has confiscated quite a bit of these drugs in New Hampshire off the streets, and they are deadly. So that's an important thing, that important message that we need to start getting out. Again, the whole thing is on our YouTube page. If you want to go look at it and listen to it, you can fast forward through it or listen to what you like, but it was really informative and we got a lot of great feedback from it. So
I just put the link up for that presentation in the chat so people can click on that link in the chat if they want to save that link.
Very good. Thank you, Kathy. Okay. So photo voice is the next thing on our agenda. I don't know, again, I don't know if you guys can see that. Did you want to talk about that, Christine, or put you right on the spot?
I know you did. That's okay. Nope. Photo Voice is a contest that we started the beginning of the month, and basically it is to showcase some self-care that people are doing, or highlight who is helping them, who is helping you or our youth get through these different times, or what is it that they're doing that could help them get through these different times. We've had a couple of submissions. Tammy's daughter Hannah won last week, which was really very nice and good to have some activity going through with it. But it's really just to give some ideas to really get people out right now, where we're kind of cooped up. People are itching to get outside. We're hearing from the kids that they're still struggling a little bit. So we want to know what they're doing for self-care for themselves, but also who's helping them with that. So we decided to run this contest. I could probably, no, I don't want to share. I was going to say I could share it, but I'm not going to mess with that. But it is on our website and our Facebook page and our other social media channels. If you're interested in learning more about it, it goes till the end of the month. You do have an opportunity, if you're interested, to win a gift certificate to a local restaurant or a local store to support even Ace Ben Franklin or Gordo's or Supreme, any of those places here locally. We'd love to have a submission from you if you're interested.
Thank you.
Anytime.
And that was really to promote what the kids were telling us. Like Christine said, they are feeling isolated, and she's been doing a great job working on them with their self-care. And because they weren't recognizing what self-care was, but once they started sharing it, they were understanding more of what it was. And we had somebody who was painting, and then one week, and then the next week, 2 people were painting. So it was sharing those ideas and getting them thinking about something that they could do. So that was exciting to see that small little group of kids. So that was the idea of Photo Voice, to get that out there to other people. So thank you. I had asked at the beginning, I know several of us here, several different organizations have similar contests trying to engage the community, engage the kids. So how do I say this the right way? It's nice that we're giving them so many opportunities. It's nice trying to figure out how they're doing with those opportunities, if they're taking advantage of them, or how we can work better to get those opportunities out to them so that they will participate. We certainly don't have a $1,000 prize like Chris and Chelsea, though, but that's very exciting to promote that for them. Okay, next thing on the agenda is our Recovery Task Force update. We met via Zoom last month, and we're meeting again next week. I believe it is on Tuesday. We've had some exciting conversations. Again, that group is in a little bit of a, where are we moving next? We need some strategic focus. And Stephen Sloan brought up a great point that we've really been promoting treatment and recovery services recently. But with the name Raymond Coalition for Youth on it, are people likely to access it, or do they think it's just for youth? And we ourselves have had that conversation when we talk about our partners at Teen Institute. They're a recovery organization, but of treatment and recovery, I guess it is, but they're teen challenge. So do adults know that they can go there? So it was a great point. And Stephen got us a new website that Kathy and he are working on, and we're going to try and make the bridge to Raymond Recovery and work it so be all of the same information that's on the Raymond Coalition for Youth site, but it'll be on a more user-friendly website, if you will. People will be more likely to go to Raymond Recovery than they would be to Raymond Coalition for Youth if they're looking for those services and they're an adult. So more information to come on that. That's developing literally as we speak, and Stephen can give us an update.
Okay, so I'm sending out the link to the sort of beginning of the website. And really what we're hoping is that more and more of our partners who are involved with recovery activities in Raymond or the surrounding communities would be willing to answer the following prompt. We support recovery in Raymond by ... and you fill in the rest of that. What we'd like to do is have all of our partners there on the main page of the site, and then it'll also link to our partners' websites where they can get more information on what sorts of recovery is available there. And then we probably are going to have some sort of other recovery-friendly assets on the page, but that'll really be the feature of it, is, you know, just a quick way for people who are looking for recovery information to access it in one really easy to use place. And if you, I'm going to put my email address in the chat box. So if you'd like to contact me to help with this, I'd really appreciate it. Thank you.
Thank you, Stephen. Okay, so if anyone's interested in being part of that meeting, that is on Tuesday, I believe 8:30. You can email me and I can email you the Zoom link, because we don't share our Zoom links publicly. We share them with you privately, obviously, for safety's sake, because I've heard of some horrifying stories that we don't want to happen here. Okay, so what's next? What's happening? Christine, do you have an update you want to share from Youth Action?
I can. So basically with Youth Action, we've been really just checking in with everyone. We've been asking them what has been going well for them since our last check-in, what are they struggling with, and we have some discussions around it. Some of them, everything's been going normal. They feel okay. They're not feeling overwhelmed. And then the next week, they're feeling isolated, they're overwhelmed, they're getting bombarded at school. So it's been a little bit of both, but it's been nice to connect them and see their faces, and they still want to Zoom every week. So they're yearning for that connection, I feel like. By looking at the screen, I think that we've got a couple of them on a call with us, Alex and Katie, and then I think we have one of our alumni Youth Action graduates, Gracie. So it's nice to see them on the call, but they're all in school right now. So for them to be on the call with us, I appreciate it, but this is just another thing for them that, you know, to stay connected and be part of the group. So I appreciate them being on the call. And then self-care has been very important, just making sure they recognize that they need to do something for themselves, get outside, painting, going for walks and runs. Yesterday's at middle school Zoom, two of the kids, a brother and a sister, they were a little bit upset that their father made them run in the rain the other day. But then they realized that the exercise was what they needed and that their dad was trying to help them just get ready to, you know, persevere through that rain, and the run to get outside was good for them. So that was really good. So we don't have any major projects going on right at this moment. We did talk about an opportunity that had come up on vaping. We're still in a little bit of talks about that with the middle school group. But other than that, it's really just quick check-ins and some communication with them to keep them all together.
Awesome. Very good. Thank you. So next is Operation Raymond Cleanup, which is not happening right now. We hope to have it happen. It will not be the capacity that it was last year, obviously. Last year was phenomenal. We did it with the school. It was great. But we just can't do that this year. And we don't even have the blessing from the town, and understandably, because of picking up trash, that they can't endorse that. I saw another community advertised for their cleanup, but they put it very clearly that they weren't responsible for the cleanup. So they were just encouraging people to clean their community, but they weren't sponsoring the event. So I think everybody's a little bit apprehensive of putting their name on anything that could potentially endanger somebody just by picking up trash. So that's not happening right now. But a piece that we are still following through with, our newsletter went out yesterday in the mail. If any of you live in Raymond, you hopefully got it yesterday, or you might get it today, with the Stronger Together message that our kids worked on for the t-shirts. And we think that message is really important right now because they really need to have that sense of together, even though they're very isolated. So those signs, we have some of our Youth Action students at the high school have offered to go around once they come in and pop them around town. So that message is getting out there that, you know, people are still here, people still care. The message went out in the newsletter yesterday. It's on our Facebook page. It's going to tie to the signs next week. So while they don't have the t-shirts to make them feel part of a bigger event that they're included with, at least we're trying to do some piece of it to make them feel part of community, because that's really important for them right now, to feel connected to their community. So that's the update on that. The next thing is our gala, our poor gala. It's our biggest fundraiser of the year. It was in March and got obviously postponed 5 days before it was going to happen. It was moved to June 18th. Now it's moved again. It's going to be on November 13th. God willing, we'll all be better by then, and hopefully we can have our event. But the venue and our comedian, everyone's been very flexible. So that was just decided this week. So we're going to be moving forward with letting our guests know. Does anybody have any questions about that? No? Okay. Our 2020 discount cards are in, which again, another fundraiser that is completely on hold. People love our discount cards to go shopping at local restaurants. They can be purchased on our website or by check if you mail it into the office, and we can mail the card to you. But again, no direct sales, unless anybody here is interested in taking a pile of cards and selling them to their contacts, which would be great if you want to do that. I know Christine was working with the kids to see if any of them are interested in doing that as well. But really, it's that person to person that sells the cards anyway, because they're only $10 and they can save a lot of money around town. The next thing I have on the agenda is the idea of a disc golf course. And this is literally an idea that we're going to float out here to you guys today. At Riverside Park, somebody brought to our attention the idea of having a disc golf course out there. There have been several different conversations about it, and nothing has really formalized into a work group effort, if you will. Riverside Park, Pam is on the call. Pam is directly connected to that park. I'm looking for where her face is on my thing. Her family name is directly involved in the park, and last year, Riverside Park Committee went to the town and asked if they would accept the park as a gift. If I'm saying this correctly, Pam, please let me know. And the town manager asked if the community would invest in the park to try and revitalize it, if you will. And I know the rec department has done a ton of activities and trying to promote it and get people to go up there. And somebody came forward with this idea of a disc golf course, which if anybody doesn't know what that is, it's they look like Frisbees, and there's a big basket with chains on it, and people throw it into the basket with chains. I've learned a lot about this. I do not play it myself. I know it's very popular amongst young people, really of all ages. I've hence learned Pat knows a lot about it. Pat plays, so. But again, people were talking about it. There was a young person who lost his life who was connected to the community, and the family did a fundraiser. And just give an example of how many dots are out there for this. They're looking for a location to put a park and work with somebody. So the coalition, I asked our board of directors if we could move forward with having this conversation and seeing what that would look like. Again, how we can help to make it happen, if we can help to make it happen. And that's where it stands right now. But I wanted to see if anybody had any thoughts or opinions on that. Anybody?
I'd like to see some pictures of Pat playing disc golf.
Yes.
I think it's good for all ages.
Yes.
Good activity for all ages.
Yeah.
Yeah, I do think the disc golf would be perfect at Riverside Park. It's a very underused area in town. You know, that might draw more people up there. It will be something, you know, to get the dog park back going, because we've had a lot of interest in that. It's just very hard getting things going at Riverside Park. It seems, I don't know if it's just a little out of the way for people. They're just not comfortable with it. But I think disc golf is very popular right now. There's courses popping up everywhere. I think that would be a great idea. And if we could pair with that family, right, that has the community ties here, I think that would be you know, a great thing for, you know, everyone involved.
Thank you. So I have talked to the mom, and they're right now they're looking at Riverside Park or a location in Candia. Her son's friends were from this area, and I know that they have mentioned that they like the idea of Riverside Park. Prior to all of this happening, I had quickly spoken with the town manager, and he said, go for it. You have my blessing to look into it. Now, obviously, that wasn't the blessing to just do it, but it was an idea to move forward and have the conversations. The mom is supposed to be getting back to me this week. So they have a good amount of money, not the full price of what the course would cost. People who can design and put the course in have gone and walked the property 5 times already. They think it's the perfect location for it because there's water there. Apparently water is a good thing for it. I would think you would lose your discs there, but there's a lot of perfect things at the location, they said. So again, I think it's a matter of the people who are interested sitting at a table and having a conversation. I know Pat's interested. Michelle, you had some information, some interest. So if anyone else is interested, you can email me and we can have a conversation perhaps to see what the possibility is. I think it would be something that if we're looking to raise money for it, I don't think it would be very difficult because it is such a popular thing right now. It's just some logistics that need to be worked out. And when we think about prevention, this is definitely a prevention thing. And I was talking to the mom and she was talking about her son, her son lost his life for the things that the coalition tries to prevent. So I don't know the details of it, I just know there's a connection to the coalition's mission. So she liked the idea of that as well. That was important to her. But seeing what that looks like, I mean, prevention, giving our kids something to do, especially that out of high school age kids that seem to be, if they want to play disc golf now, they have to go to Dover or Manchester, they have to travel, and sometimes travel is a hard thing. So this hits a lot of boxes. So it's something that we're looking forward to exploring as we move forward. I think that's it for what we have. Does anybody have anything else they want to add? No? Yes, Kim.
Sorry, I just wanted to, can I share something about vaping or would you like me to not?
No, go ahead.
Okay. I'm not, and this is not intended to scare people by any means. This is just awareness. In our presentations, before we had to worry about anything like COVID-19, we let people know that passing around at social settings and sharing devices was not necessarily a good thing. Viruses like this, because of them coming from droplets and from just people to people. So sharing devices is definitely a concern among people of all ages in this current situation. With restaurants opening, people need to be aware for the outdoor seating and stuff. People need to be aware that some restaurants allow smoking and vaping in their outdoor settings because there is no state law that says they can't have that. So if you're in a situation where you go to an outdoor space to eat, just keep in mind people could be vaping or smoking. They're exhaling into that environment. So it's just an unknown thing right now. DHHS tried to work with various people before they declared the restaurants being allowed to have outdoor seating and brought, to the conversation the fact that we don't know the possibilities of viruses being spread through, especially aerosol from vaping, because it's a denser thing than cigarette smoke in some cases, depending on the type of device used. So I never even thought of it, even with all the reading and work I have been doing on this. So it's just, again, if you can discourage young people or adults from sharing devices right now, that's a good thing, but also just to be aware that we don't know, we have concerns about the aerosol that's expelled in social situations.
Do you have any materials on that to share?
No, there's no data because it's even the eValley cases that were being studied, that stopped immediately in February of this year. As soon as COVID-19 and these other illnesses started occurring around the country. So the last even lung health thing as far as related to vaping and the use of vitamin E acetate, marijuana, THC, because that's a lot of the hospitalized cases of the valley, that study stopped. I mean, they're still tracking that, but now it's COVID-19 resembles numerous other things, as does the valley cases. So I don't have data to share. It's just, it came up on a policy call from some health and human services folks that they expressed that concern with outdoor seating and social situations that, it's just another potential exposure thing to be concerned about. Unfortunately, I can't, everybody, I just feel bad for everybody because we're all put in different situations, but there's no good way to slowly reopen businesses, but we have to try with all the precautions in place. But this is just kind of an unknown thing if you're in a group where someone's vaping or smoking.
Kim, do you think where the restaurants are, well, some of the restaurants are very eager to open and make this be a successful thing? Do you think, did you say that they've been provided this information already, or?
It was discussed in the governor's, those different task forces, those meetings, and I didn't hear the discussion for this particular thing, but it was brought to the attention of that group that this might be a health concern. But here in New Hampshire, we just have the Indoor Smoking Act as far as restrictions on smoking and vaping indoors. We don't have, some states have rules about outdoor spaces at restaurants, and we don't. So different businesses can, in their outdoor spaces, allow what they want to, whether it's smoke-free or not, or vape-free or not. So again, it's not meant to be a scare tactic. It's just one of those things that's out there in the public health community that we just don't know for sure. It's when you think about all the restrictions right now, for salon and barber shops, in retail locations, the cleaning they have to do and the face masks and all that. Well, you don't wear a face mask when you're eating.
Right.
It's just the workers are going to. But as a guest or as a customer, you're not wearing a face mask when you're sitting in the outdoor restaurant seating. So I don't know, if I hear more, I'll definitely let you know, but it was one of those things, I just didn't think of that. I was thinking about sharing devices and trying to get it across to younger people, especially that, you don't want to be in that close proximity, right, especially with non-family members. Plus, you also don't want to share devices and pass them around. So.
One resource I have that's not completely related to either of those two specifically is I did just receive the link for a video that is for 7th grade and up. And it's titled Vaping and Viruses, Your Lungs, Your Life. So it speaks to the greater risk people who are vaping may have in terms of any virus, but it does really speak a lot about COVID. So if that's helpful, I can share it.
Yeah, we know the data we do have, and we do know smoking and vaping irritate your lungs, even if you don't have health conditions. It irritates your lungs to a point where it makes you more susceptible to viruses, respiratory viruses. It also lowers your immune system. So regardless, you can't say, oh, I've vaped for only 6 months, so it's not me. We don't know, because the vaping aerosols, devices, and everything are so different. The Valley cases, the kid that had the lung transplant had only vaped for a few months. So, there's a lot of unknowns, but we do know for a fact that smoking and vaping do irritate the lungs, potentially harming your lungs permanently. Obviously, there's brain impact for the nicotine. But it's just, you're opening up your respiratory system as a whole to a variety of things, and especially right now, this virus in particular. But
Thank
yeah,
you.
thank you for your time.
I feel
everyone.
like there's something that we could do to educate the restaurants about the chances of why it would be in their best interest to have their outdoor seating smoke-free. I feel like if we educated them on that,
I
feel like they kind of should know that.
I have another policy call tomorrow that the state staff member will probably be on, so I can learn more, because they were participating in the discussions behind the scenes with the different task force committees. But obviously I read the guidance. I didn't see anything about not allowing smoking and vaping in the guidance that was released for outdoor restaurants or seating. So it looks like it's not not mentioned. I think it was discussed, but I'll find out more tomorrow. And if I get any more facts as far as, but it's not in a published document. So.
Okay, thank you. Does anybody have something else they would like to add? Pat, do you have anything about the after school program? You just got a great report back. I think that's worth highlighting and celebrating.
Okay, yeah, we had a big visit. It's required for every program in their third year. Believe it or not, I feel fortunate that we got ours done before everything got shut down, because there were a lot of schools that had to go through it this year, and I think we were one of only 2 of them that got it in before everything got shut down, so that was good. There were 21 different categories that we were judged on, and most of them were judged as proficient, so that's not a bad thing, and none of them were at like the lowest level, whatever that was. So right.
It was awesome. It was fun to read the report and see. Yes. We're lucky to have you in that position. So kudos to you for a great program.
Thank you.
Pam?
Yeah, I didn't know if you wanted to mention that Saturday Night Live video that was really horrible. I don't know if people have seen it, but if there's a way to maybe, write somebody or express their concern about it.
Did any of you see the Saturday Night Live video that was on Saturday night? I kind of don't want to show it to you. It's awful. I don't know. It was brought to our attention on Monday morning. And it's a skit. It's Saturday Night Live, obviously. Their job is to be funny and to try to get people to laugh. They have all of their personalities, their actors, saying something about the COVID-19 epidemic that we're in, how people are isolated, how people are alone in their homes, how difficult it is. They basically identify all of the risk factors that we know are a problem with COVID, and they say how they affect the kids and the adults, and then they say, let the kids drink. And it's numerous pictures of young people drinking alcohol, from beer bottles, champagne bottles, mixed drinks, and it goes on and on and on. It says, let them smoke weed. It was very disturbing to watch. It was very difficult as a prevention person to see that they were mocking this so openly. It got a lot of attention on the radio. I contacted our news channel, but they didn't get back to me. Obviously, prevention is not something that people talk about all the time. It was very difficult. Christine showed it to the kids the other day, and I think that was almost an even harder reaction to listen to what they had to say. We wanted to see, and a couple of them said, it's Saturday Night Live. It's supposed to be funny. That's what they were trying to do. They were trying to be funny. And then one of the girls said, even though it's trying to be funny, it's difficult to watch kids, even though they're pretending to be doing that. But it spoke to the fact that the kids even normalized this. That's what we took it as, that the kids didn't really see an issue with it because it was funny. I don't know if anybody has the link, or if you can get the link to share it, Kathy, in this chat box. It's on our Facebook page on Monday, and some conversation ensued after it. I did contact Saturday Night Live with a letter that was suggested from Community Anti-Drug Coalitions of America, just basically saying, you know, yes, it was intended to be funny, but you really need to think of the repercussions of what the message is you're sending. It was hard to see. I don't know if anybody else, Christine, if you want to add anything, or Pam.
It definitely was a little challenging. You know, we're all in this situation together, and just to see some of those images was just like, I couldn't watch the video trying to show it to the youth action kids. I couldn't even watch the whole thing with them. I felt awful. But it was definitely eye-opening, and I've been watching on Saturday Night Live for a very, very long time, and I felt that they just took it over the top with this video.
And there were definitely two sides. There were definitely people, I mean, because it went crazy on the internet. It went crazy on social media.
Yes, it did.
Put it on our Facebook page, and we got some mixed reactions. One person chimed in and said, you know, it's a show that's on at 11:30 at night. If parents are being proper parents, their kids are in bed. Well, that's true. But that show, again, it came to our attention at 8 o'clock in the morning on Monday morning, and it got a lot of attention. People were talking about it in lots of different venues. So kids were having access to this video in many different ways. And it was just disturbing to see. Somebody asked us why we put it on our Facebook page, why we were promoting it. And it was an opportunity to have a conversation. And I think that's how we look at things, that if you don't bring things out in the light and you don't address them, then that's just as bad as ignoring them. So if you can use it as a teaching opportunity and an opportunity to have a conversation, that's really important.
I just shared the link to our post in the chat. So if people want to look at the chat window, they can see the link to our post about it, which includes the video link. And just what you had to say about it, Celeste, and sharing, and to see the conversation going back and forth as well. We watch Saturday Night Live pretty much religiously every week, and we watch it the day after on streaming. And I was just, no, the whole time. I couldn't believe it. I just couldn't believe it. And I posted on my own and tagged them and said, you know, I've been a fan since the 70s, and this was just not okay. It was just not okay for so many reasons.
So, but it speaks to how challenging our work is and the work that needs to be done. So someone once said, who's works, Tim Rourke, many of you know him, it'll be, the ideal thing would be for there to be no need for our jobs, but that's not very likely that that's going to happen. So, I mean, we can hope that there's no need for our jobs and we'll be out of business, but with things like this, these things normalizing, and that's what people don't understand. It's so simple to normalize it, and then the effect that that has on our kids. So just to be aware. Thank you for bringing it up, Pam. Does anybody have anything else? I had an update on marijuana legislation, if anybody was interested in that, from the Smart Approaches to Marijuana in New Hampshire. They've been doing a lot of trainings, if anybody is interested in them. There's been several different there's been lots of trainings since we entered our home life workspace. we can learn all kinds of things. But the legislation has turned down legalizing marijuana in New York, New Jersey. There was another one. It was when you think about the fact that everyone says, oh, it's inevitable and it's going to happen. It's not necessarily inevitable and doesn't necessarily have to happen. States like Massachusetts, where it has become legalized, 80% of the communities are banning it, so it's not allowed to be sold in their community. So these states are taking very proactive things that even though the state has legalized it, local communities are banning it. So that's an important message to send, that not everybody wants this to happen, and it's not necessarily a good thing. And the data that's coming out of the states that have legalized it and do have shops, it's kind of disturbing to see how much it's increased. So something to be on our radar. Kathy is going to take a screenshot for us if everybody wants to look at your camera and smile, so you're not drinking a cup of coffee or doing something silly, if you don't mind.
Okay, hang on just one second. I have a different interface than you guys do, so I have to do it a little differently. Sorry.
I can do it if you want me to.
If you have a one button screenshot, I don't.
Okay,
I do.
Christine, if you can.
Awesome.
Absolutely.
Thanks.
All right. 3, 2, 1. Good job.
Thank you. Our yearbook for the year is going to have lots of Zoom pictures in it this year. Everything we do is Zoom now. So I guess that's it. Our next meeting is on June 11th. I guess we'll see you then. I hope you all take care of yourself. And remember to take it slow and go outside and enjoy the sunshine. Thank you very much for everything. Have a great day.
you.
Thanks.
Thank you.
Bye.
Bye, guys.
Bye.